Welcome to the session on legal aspects of healthcare in India. It's very important to understand what are the various legal aspects all the health professionals, especially the nurses, should know about. It is very important to understand the legal aspects if you follow the legal guidelines, if you know what are the legal acts, what are the components of those acts, you can not only save yourself, your hospital, but you can make aware your patients about various components of the legal aspects. And it's important because you have to provide safe, quality care to the patients within the guidelines, framework and the legal framework which is given by the state or the country. For all aspects of health, there are binding rules that governs not only the hospital but also the health professionals, government, NGOs, civil bodies and even the people who avail these services. Together these rules make up the legal framework or legal architecture for the health. They take many forms including statutory laws, regulatory administrative laws, contract, case laws, customary laws. Who is involved in making these laws and from how it formed, it differs, the system actually, the procedure of making laws differ from country to country. Even the content of the laws, regulations vary from country to country. The legal framework for health in India is as per Constitution of India. I think all of you have read the Constitution of India when you were in school. Constitution has a chapter on fundamental rights which guarantee certain rights to the people such as freedom of the person, freedom of speech, freedom of religion and various other freedoms are given and the rights are given in the Constitution. Government agencies are the prime regulatory bodies in the country. Government plays a key role in setting policies, designing and implementing the regulation. Also responsible for implementing and enforcing these regulations and ensure that there is a compliance. There are certain regulations, instruments which are known as acts, laws, schedules, notifications, ordinances, rules and regulations, resolutions, bylaws, licensings, certifications, order by the executive bodies and judicial orders and various other forms. So let us see meaning of some of the terms, very important to understand the difference. What is an act? It is a bill which is passed through various legislative steps required and which has become law. Like National Nursing and Midwifery Act, latest in context of the nursing. Now, Indian Nursing Council Act will be replaced by it. Rule. Based on these acts, various rules and regulations are being formulated. Rules are an established standard guide or regulation governing the conduct, procedure or action. Regulation, a rule of order having the force of law prescribed by a competent authority relating to the actions of those under its control. What is a policy? I think all of you know we have various hospital policies. Your policies for your leave, for your welfare activities, for various other policies, for the protocols, for the procedures, professional activities, what you do. But here it means the general principles by which a government is guided in its management of public affairs or legislature in its measures. That orders are a mandate, a command or direction given by authority. I think in the hospital also you must be receiving various orders which give instructions to the employees. You have to do this, and or during the disasters various orders are being given for the posting or to follow certain guidelines. Then notification. What is notification? Issued by a government, center or a state government to exercise the power of a legislative enactment. Those notifications generally lay down the law, taking care of some of the procedural aspects. So regulations can also be formulated and implemented by state government or the local bodies, usually under the constitution or delegated authority from the national or the state level. Standards and guidelines are released by the government and code of conduct suggestions by the self-regulatory professional bodies, etc. That means even if you see standard procedural protocols are SOPs are there in the standard operating procedures, which are given by the hospital to be followed by all the staff to carry out certain procedures or certain activities. If you see in certain diseases, the guidelines are given how to treat the patients. So standards and the guidelines are released according to the need. Healthcare involves discharge of professional duties by the healthcare professionals, which sometimes may lead to act of medical negligence, wrongful actions or omissions of professional by dealing with the patient. No one is doing purposefully any medical negligence. There can be certain reasons. So every hospital has a procedure to take care of, deal with this medical negligence. If it is a grave negligence, yes, actions are being taken as per the policy or as per the guidelines. Then medical negligence, failure to act in accordance to the standards of reasonable competence. Medical malpractice is also known as breach of duty of care. Identify a breach of the duty of care is important in determining if there are grounds for a negligence. Sometimes people may do due to certain reasons the negligence, and disciplinary actions are taken against them as per the policy and the procedure. Therefore, there is a disciplinary committee which takes into account, they deal in detail what are the consequences, what was the situation, what the document, how it is documented, it was documented or not, it was signed or not, and what was the situation. They interview various other co-workers also who were present there, and they see if it was a medical negligence done purposefully or due to some other reason. Accordingly, the action is being taken. Then cases of medical negligence can be brought before the court either for criminal liability or the civil liability. Tort is breach of a duty independent of contract which cause damage to the patient, giving rise to civil cause of action. Sometimes, if you have seen in the private hospitals, many times you must have heard in the news, patient was operated in a right instead of right eye in the left eye, or some other mistake is being done. Then they go to the court and the court takes the decision, again keeping in view all the records, situations, then taking the witnesses are there, then the compensation is paid to the patient or whatever action legally is being taken. Medical torts are those which the health professional or organization cause injury to the patient, and then again the patient goes to the court, or sometimes the case is also first referred to the medical council or the nursing council, and if the patient is not satisfied, they even go to the court of law. Self-regulation, very important. Every doctor, every nurse, every allied health worker is responsible to regulate themselves as per the code of conduct, as per the oath taken by them when we start our profession, if you remember, all of us take an oath, we will not harm anyone. That is the first thing we have to remember. So self-regulation is very important. Licensing, accreditation, certification are some of the other things which are very important. Licensing means, if you know, all of you are registered as registered nurse, registered midwife, that is RN, RM. That now you have completed your training from accredited approved college or school of nursing, which has followed the curriculum of Indian Nursing Council, and you have passed the exam, and now you are ready to practice after certification from your council. And you have to practice as per your code of practice guidelines. You cannot practice beyond that. Certain limits are there. After that, you have to refer the case to the doctors. Same way, doctors are registered with their medical commission now or the state councils, and they practice as per their guidelines. And all the college and school of nursing or medical colleges are approved or accredited by the medical commission or the nursing council. Even the hospitals nowadays, if you know, accreditation is being done as per NABH and various other guidelines from time to time, which are being given by the Government of India or which are being modified by Quality Council of India. All the hospitals are accredited as per the guidelines. That means these hospitals are safe, they will provide quality services, and they are accountable for the services for which they are being meant for, and they appoint the qualified staff who are registered with the council. Then certifications are given for certain procedures and action by authorized people, agencies, that they can do certain procedures like PNDT. PNDT Act, safe abortion. Your family welfare department has to certify, yes, this organization is fit for providing safe abortion services under PNDT Act. There is adequate staff, adequate facilities are there, and they are responsible for providing these services. Purpose of regulation of health sector is to ensure to access quality, cost-effective care to the people, because people come with the faith to the hospital that they will be transparent, they will provide, they are standardized, they provide quality services, and staff are qualified and knowledgeable to provide these services. Regulations ensure accountability of service provider also. That means if it is a private sector, NGO sector, or a public sector, they are accountable for and maintain their privacy and confidentiality of the patient, of the records also, and there will be no malpractice. Then the Constitution of India, the directives of state policy act as guideline principles for the government to enact laws and policies but are not justifiable. Your Article 38, 39, 42, 43, 47 in part of directive principles of Constitution provide for the promotion of health, nutrition, standard of health care. You can see your Constitution is the first regulatory body which give rights to the patient. The Article 47 states that the state shall regard the raising of the level of nutrition and standard of living of its people and the improvement of public health as among its primary duties. That's why it is a state responsibility to provide good health nutrition services to the people. Article 21, right to life, which is fundamental right under which the right to health and health care is submerged, because there is no separate right for health. It is a part of right of life of the people under the Constitution. The 7th schedule Article 246 of Part 11 of the Constitution divides the legislative power into three lists. That is, first list is union list. The union government is responsible. Second is state list, where state is responsible. And third is both state and the center both are responsible to provide the essential services. If you remember, in the COVID also, during epidemic and disaster, the center and state were responsible for providing all the services to the people. So that is known as concurrent list, where the matters regarding your population control, family planning, security, social insurance, medical education, medical professions, prevention of communicable diseases, maternity benefits, your vital statistics, all are part of concurrent list. Then international conventions of acts are there, standard setting, establishing the regulatory frameworks. And this international health regulation provide legal framework that defines the right and obligation of the countries of handling the public health issue. I think COVID is the latest, you can say, which gives that internationally the standards of public health were followed, and all the countries collaborated for providing the drugs, vaccine and protection to the people, especially the social isolation, universal precautions that has to be taken care not only by the health professional but also by the public. Then acts that govern certain, I will just run some of the acts all of you have gone through during your GNM or BSc course. Drugs and Cosmetic Act, Environmental Protection Act, Infant Milk Substitute Feeding Bottle and Infant Food Regulation Act, Destructive Insect and Pest Act, Draft of Bill Act of National Institutions of Importance, National Nursing and Midwifery Commission Act, National Commission for Allied Health, National Medical Commission, Drugs and Magic Remedies Act, Public Notice regarding Amendment of Drug and Magic Remedies, Epidemic Disease Act 1897. You can see this was implementing during any disaster and even during COVID pandemic also. Notification of Mental Health Rights of Person with the Mental Illness, Mental Health Care Act, Notification of Mental Health Care Rules 2018, the Transplantation of Human Organ Amendment Act and Rules 2014, and previously these rules were given in 1995 and 94. The Food Safety and Standard Act, Food Safety and Standard Rules in 2011, they are being again amended. The Medical Termination of Pregnancy Rules, the Medical Termination of Pregnancy Amendment Act of 2002, which was first given in 1971. The Preconception and Prenatal, that is PNDT Act, and which is being amended in the 2012. The Prohibition and Sales of Cigarette and Other Tobacco Products, the Cigarette and Other Tobacco Products Prohibition in 2003 Act, and the rules came up in 2004. So you can see all these acts and the rules, very important for every health professional, whether you are working in a hospital or a public health area. Very important for all of you to know all these things, because you have to save yourself, your organization, and make aware of public about all these amendments and the rules also. So Charter for Patients' Right, very important. Every patient has a responsibility and rights also. Some of the rights are: every patient has a right to adequate relevant information about the nature and cause of illness, their provisional and confirmed diagnosis, proposed investigation, management, that is your nursing and the medical treatment, and proposed investigations, possible complications to be explained to the level of understanding in the language that patient can understand. Most of the time we speak professional language or medical terms which patients and relatives are not able to understand. Whenever you make them explain anything or take a consent, explain in their local language the words which they use locally and take back the feedback how much they have understood or re-explain them if certain doubts are there. Treating physician has a duty to ensure that information is provided in simple and language which the patient understand and communicate either personally or by a person who is assisting the physician. But sometimes, like nurses explain about certain procedures, but doctors also have the responsibility when they do any surgery, they have to explain to the patient how the surgery will be done, what are the safety measures, what are the potential complications and recovery time approximately about the patient. Never give a false assurance to any patient. What is the reality? Speak in a way the patient can understand it, rather than saying we have explained and patient has not understood it. Then every patient caretaker has the right to know about the factual information regarding expected cost of the treatment. So many times patients, they come in emergency, they hardly know how much cost will be there, and when they have to pay, they are in crisis. So it's very important when things are settled down, please explain how much cost so that they can arrange the finances, or if they want patient condition is stable, they can transfer the patient to some other institution where they can afford the care. Hospital management has a duty to communicate information and inform if any additional cost is incurred if the condition of the patient is not good, or it is transferred to the ICU, because all of us know ICU charges are very high, or if patient is operated, they have to pay the extra charges in case of emergency. So they have to be informed in time. On completion of the treatment, the patient has the right to receive item-wise bill, receive an explanation why this bill is there if they feel the payments are very high, what will be the source of payment. They should know how they will pay the patient. It will be through card or through insurance or through their department, and what will be the mode, and they should receive all the receipts of the payment. Every patient or the relative has the right to get originals of the investigations or copies of the case paper if they are admitted in the indoor department investigations during the period of admission, preferably within 24 hours, and after discharge within 72 hours. In case there is any payment for photocopies, they should be informed about that. But patient has every right to get their documents, because maybe in the future the patient needs these documents for further treatment, or patient needs second advice, or patient has to submit to their department for the bill clearance. So caregiver and patient has the right to get the discharge summary or the death summary along with the original copies of investigations. I think these are some of the patient's right which is very important for you to understand why the patient demand papers. Sometimes the hospital refuse, but you have to tell what are the policies and guidelines and how they can get these documents, because it is their right to get it. Tomorrow, if I want to go for further treatment, my other doctor, or if I leave that place and go to other place, the doctors need to know what treatment I have undergone. I hope this session has given you an overview what are the legal frameworks in India to be followed by every organization and the health workers. Thank you so much.